I'd like to call to order the regular board meeting for Mount Diablo Unified School District for October 14th, 2019. We'll start with a roll call. Mr. Lawrence?
Here.
Ms. Mason? Here. Ms. Mayo? Here. Sorry. Ms. Cowan?
Here.
Sorry. And Ms. Durkee is here. I'm sure I turned that off. Sorry, folks. We will start with, sorry, let me get it off so it doesn't do that again. We will start with public comment. And the public may address the board concerning items that are scheduled for discussion during closed session only. These presentations are limited to 3 minutes each, or a total of 30 minutes for all speakers, or the 3-minute limit may be shortened. Speakers are not allowed to yield their time. So we have cards already, and it looks like we can manage this within the time limit. I always tell people that the purpose of public comment is for board members to listen. And if this is your first experience doing this, I think it's important to know that we are not allowed to respond or to ask questions or enter into dialogue. We can ask clarifying questions. So I don't want people to be offended if you're not getting a response, if you're posing questions to us. So again, our job is to listen. And so we will start with Anita Johnson.
Good evening. I'm Anita Johnson. You all hear me okay? Okay. I am president of Mount Diablo Education Association, Medea, and I am here to make some comments about Medea negotiations. Why is it taking so long? We have been discussing this contract for over 15 months. I respectfully request that you direct your team to do their job, bargain in good faith, and reach a settlement as soon as possible. Employees already know that management does not respect them and does not care about them. As you continue to allow your team to delay and stall and violate legal directives, more and more people are asking when this board will step up and take responsibility. When you speak with the managers, please ask them why they did not provide the data we requested, why they claimed they sent the data when they had not, and most importantly, why they were not prepared for discussions today. I hope you will explain to them that this task requires a strong sense of urgency. Please question them about their priorities and provide them with appropriate priorities. I truly believe that district management needs very clear directives. They are not representing you well by their actions. They are demonstrating by their actions that they do not believe that a fair settlement in a timely manner is important. There is a disconnect between management actions and what I believe are your values. The longer you allow this disconnect to persist, the more the community is questioning what your values really are. Please fix this problem now. Thank you.
Thank you. Linda Ortega.
Good afternoon. My name is Linda Ortega. I'm Vice President of Medea, Mount Diablo Education Associations, and I want to piggyback on what Anita has said. We had just completed our second mediation day, or the 21st day of bargaining, 21 days. And I'm here because I'm very disappointed and very angry that it's taken all this time. We have teachers on our bargaining team that had to take time off of their time with their students. They rather be with their students, but they know the work that they're doing is very important for our members. And we just want you to understand, we want to stay here at Mount Diablo. We have wonderful teachers that want to stay here, but it's getting ridiculous. They need to know, where are we going? What's happening? Who's leading this ship? And they're asking us. And to be honest with you, I don't know what to answer them anymore. So our members deserve a living wage. Our students deserve lower class sizes. And our community deserves a school board that puts our students' needs first. Also, I just want to say, Dr. Martinez, welcome. I heard wonderful things about you. from previous employees at Fairfield Sassoon, and they told me that you're a person who would like to get things done. And I'm watching, and we're all watching, and we're all hopeful. And also I wanted to tell you a special number, 84. Okay, thank you.
Clarifying question.
Dan Reynolds.
Good evening, y'all. I speak to you tonight as the new Medea Executive Director. Talking about negotiations, I am hopeful that settling a fair, student-centered contract is one of the board's priorities. I have heard that it is. I have seen Facebook comments from a couple of y'all that say that it is. I would like to see that be the truth. I would like to see the board doing its responsibility by understanding thoroughly what is going on and giving your negotiations team the direction that they need to settle. Because they are not showing up at mediation with direction from y'all. If you're giving it, they're not hearing it. If you're not giving it, why not? They are your team. Please do what you need to do to prioritize a fair, student-centered settlement and direct your team to show up ready to do the work under the authority that you have given them. It is your job, and I hope that it is a high priority for you. You can show that it is by having your team show up ready to exercise that authority you have given them. Thank you.
Thank you. So we have Tracy Cannon and, so I have like this one of two, one of four, two of four. Are you all coming up together? Okay,
Yes.
great. Thank you. So we have Tracy, Susan Dames, and Christine Merritt. And a few others, I guess, right?
Is it okay if I go first?
Hi, President Durkee, Dr. Martinez, and members of the board. My name is Hillary Garcia. I'm one of the credentialed school nurses. I wanted to talk to you about contract negotiations today. We would like to ask for a reduced caseload number of 1250 to 1. This still, of course, exceeds the recommended practice standard, but as you know, healthcare needs in our district are increasing in both number and complexity. I also wanted to clarify that the contract ratio that we're asking for, the 1250 to 1, is for credentialed school nurses placed in service of schools. So that would be excluding credentialed school nurses on like special assignment, which would be the preschool assessment center, which should be a 1.0 FTE. Currently, they're sort of operating on a 0.85, and they are impacted by that. The rest of the preschool assessment team is being impacted by having reduced credentialed school nurse time. And then, of course, also the lead nurse coordinator, which is me. Currently, I'm half release, and I'm really, it's not enough time to be able to support the other credentialed school nurses, to bring on new school nurses, and to support school staff who need questions answered on a very regular basis. I'm definitely being pulled every single day of the week to support school sites that are not my own. And I'm happy to do it, but there is that need, and I just want to make sure you know that. And when we're asking for this contract ratio, we want to make sure that that's for nurses who are serving the schools specifically. On Monday, today, we had 70% of our credentialed school nurses pulled from doing their regular job assignments to service students with healthcare procedures because they couldn't be staffed. I also want to mention if there is, there's consideration of bringing on students with extremely complex medical needs from the County Office of Ed. And I want to, again, make sure that you're aware that this is being considered. And with those students who are extremely medically complex, again, that's just going to continue to add to our caseload.
evening, board. My name is Tracy Cannon. I am a graduate of the district, and I'm one of the school nurses, and I'm also a parent of 2 kids in the district. And I'd just like to address Veronica Pisani. She was our previous Administrative Secretary of Student Services. She retired last year, and her position, as far as I'm aware, had been, what I've been told, it has been frozen. She had many critical job functions, not the least of which includes a direct impact on coordinating staffing for the numerous complex healthcare needs needed to maintain student safety. She managed all our 108, as of now, specialized healthcare assignments, which is daily reaching out to agency nurses to make sure every one of those positions is filled for that day. She'd often be on the phone early in the morning and late at night, making sure there's people to make sure every single student on that list has their support that they need to be safe at school. She would reach out to the SEAs, the nurses, everybody. She coordinated with everyone. So it's just unreasonable to expect that all her duties are now placed on our administrator, Linda Pete, who already has a full plate. 3 weeks ago, a coworker, another nurse, learned of a new student coming to the district who was going to need every hour G-tube feedings. So immediately she notified Linda, who reached out to the agency to ask for, what kind of nurse support, and they didn't have anyone. She was going to have to look into a 3rd agency. It's just becoming just really difficult finding agency nurses to support all the student healthcare needs. So we are asking that this position is unfrozen and can be filled as soon as possible. Thank you.
Thank you. Good evening, Dr. Martinez and board members. My name is Susan Daines, and I am a district nurse now going on my 3rd year. Prior to that, I was a Maxim nurse for a couple of years, and before that, I was busy at home raising my 5 children. I've been a concerned parent, a PTA president for many years in this district, 19 years that I've had kids in this school district. I want to talk tonight about the Medea contract negotiations, specifically about my concern for the safety of the students in this district with healthcare needs. Just to go back a little bit, in 2016, we had 29 students with diabetes. Currently, we're at 52 students with diabetes. That's a 44% increase. Students in 2016 with specialized healthcare procedures, the number was 75. 2019, it's 108, which that's what we passed around, that you have a 31% increase. We are understaffed for healthcare issues and needs in this district. Personally, I'm a .6 employee. I had 2 schools, the Sequoia Elementary, Sequoia Middle School. And then last month, or in August, I was notified that I would also be getting Sunrise and Shadelands for my 3 days a week to juggle those schools. And you're probably familiar with Sunrise and Shadelands, medically fragile students. Veronica, with her specialized healthcare procedures, her position is critical and essential. Also, we've lost Chris, who's moving this week, who is our health clerk and is very supportive to the nurses. This all just adds to us feeling understaffed and overwhelmed as school nurses to do the job that we are supposed to be doing and that we want to do and that we're happy to do, but we do need fair caseloads. Maxim nurses, I was the nurse that Tracy just talked about, that I was sitting in a SARB meeting when I learned about this new little 3-year-old that was going to be coming to Shadelands, and we needed a nurse for her. And to consider, having to go to a 3rd outsourcing agency, I think it's time that if we know we have these healthcare needs and the projections, you look at the graphs, they show that they're increasing. We need to project based on those. It's time to hire more district nurses, more school nurses. Today, 7 of the 11 were working today. They were pulled to other school sites. With the current caseload, we're jeopardizing student safety and increasing nurse and district liability. I propose a solution. Number 1, unfreeze Veronica's position today. Please lighten the load of Linda Pete. She has so much on her plate. Number 2, fill Chris Bridgems or open a position for her.
decrease the caseload to 1 to 1250, and support our administrator to help find more nurses and attract them. Thank you.
Thank you very much.
Hi, good afternoon. My name is Christina Merrick, and this is my 9th year as a credentialed school nurse in the district, and I'd like to address the Medea contract negotiations. I'm one of only about 14 FTE for the entire district. Our current caseload is 1 credentialed school nurse to 2,700 students. Last spring, the school nurses came to back board meetings here in front of you guys. 4 times actually in the spring, and requested to please lower our school nurse caseloads. We heard crickets. At that time, I was part-time, 3 days a week, 3 schools. I had El Monte Elementary, a Title I school, Wren Avenue Elementary, a Title I school, and Diablo View Middle School. That caseload allowed me only one day a week at each school. And that was unbearable, and that's why we were here. This year, I'm not sure if it's retribution for us standing up for the safety of students, but I now still work those same 3 days. I have those 3 schools, and now I have a 4th school, Bridge, which got the trail students from Ignacio Valley High School that are medically fragile, and more students are coming. That's an entire high school worth of special education at the Bridge program, that they have tons of specialized healthcare procedures that need to be addressed, and they need nursing time, and this is not sufficient. I said, how can I do 4 schools in 3 days? Math, how is this gonna work? I was told I need to cut down on my Title I nurse time. Let that sink in. You're gonna cut from the most vulnerable. Cut from those that need the most. Where's the equity in that? So every week I'm switching between El Monte and Bridge, so they get 2 days of nursing time a month. Never mind how my coworkers discussed about covering for LVNs or SEAs when they're absent, such as SEAs 2s and 3s that are doing medical procedures. So one of them was absent at one of those schools, so El Monte got 1 day of school nurse time this month. In 4 weeks, 1 day. Aside from the current school caseloads being unsafe and unmanageable, the number of healthcare procedures continue to skyrocket. We discussed that since 2016, we've had an increase in students with type 1 diabetes by 44%, and our staffing is not keeping pace to keep them safe. On top of our caseloads, we discussed covering the LVNs and SEAs, and with the 14 FTE, we have covered 29 times in 2 weeks. 29 times. We are not staffed to be constantly being pulled. Out of the 10 nurses that work today, only 10 nurses work today, 7 of them got pulled to do to care for students under someone else's job description, which means that our jobs keep getting impacted. They keep having care team meetings and SSTs and IEPs, and all the requests of us keep adding, and we say we can't be there. I have to go help this other child. This must stop. The district must be able to step up and protect these students. The district hashtags of MUSD wellness is great, but look, this is black and white. MUSD is not a district that is dealing with the fundamental aspects of wellness. One Facebook post about a mindfulness class is great, but you have students with enormous amounts of healthcare conditions that are not being addressed, and we need to. Thank you.
Thank you very much. Okay, yes, that closes our public comment before our closed session. I'm now going to share the items that will be addressed in closed session. So 3.1, item number 1, discipline, dismissal, release, or reassignment of public employee, Government Code Section 54957B11 case. 3.2, item number 2, anticipated litigation, conference with legal counsel pursuant to Government Code Section 54956.9B, 2 cases. 3.3, item number 3, negotiations. The board may discuss negotiations or provide direction to its representatives regarding represented employees pursuant to EERA, Government Code Section 3549.1. Agency negotiators, Dr. Robert Martinez, Lisa Murphy Oates, and Roy Combs. Agencies, MDEA, DMA, MDSPA, CSEA, CST Local 1, and Teamsters Local 856. 3.4, item number 4, readmission of student number 05-19 into regular schools in Mount Evelyn Unified School District. And we're now adjourned to closed session. Thank you.